Healthcare workers like Liz Whynott, the director of HIV health and prevention at Tapestry Health, have observed a disturbing trend in recent years. The opioid epidemic has meant a rise in IV drug use, shared needles, and spikes in hepatitis C, which can destroy the liver. That's why she says that syringe access programs, also known as needle exchanges, such as the one that recently opened in Springfield, can be lifesavers. But SAPs bring with them lots of controversy, too. We discussed all of this in the studio.
Syringe access has been needed in Springfield for an extremely long time, and this is an initiative that's long overdue. But at the same time, I'm just so happy that we're going to finally be able to provide this additional service to people that are actually using drugs. Springfield, in addition to other cities in the state, of course, but focusing on Springfield, it has had a high amount of HIV and hepatitis C attributable to injection drug use for a very long time. It's always been a city that has some of the highest numbers of HIV and hepatitis C in the state, and at times throughout the past 20, 30 years in the country. And also the number of overdose deaths have been particularly rising in the past few years, but before that there's been a problem with overdosing and people dying that live in the city of Springfield for quite a long time.
A couple of things you just said that I want to have us unpack. Let's start with the fact that you think that this is something that's long overdue in the city. Leaders here have been looking at this issue going back 20 years, 1998. What do you think is different now? Why approve it now?
Sure. Well, I think the landscape around how we view opioids and talk about the issue around people who have dependence on heroin and other opioids is different. About possibly 5 or so years ago, there was this shift that the state and the country noticed where more younger people that living in rural areas that were also, middle class, white, mostly people were dying of overdoses. And what I really think that meant, and what I guess I'm trying to say, is that a lot of people, I think, started to pass away from heroin, and those people were reflective of the people in power that are able to make big decisions like this.
Because in other cases of drug epidemics, when you look at the crack epidemic especially, primarily the African American community was affected and prosecuted for those offenses. It's a very different approach to opioids, which has enraged a lot of people, rightfully so.
Rightfully so, yeah.
But so to your point, this is maybe you're thinking people in power take notice of this more quickly because their constituents are going to them.
Yeah, and the language around the opioid epidemic has changed from a criminal one to a public health issue. So I think that a lot of, again, people in power and just a lot of people are taking more notice of this and have really, I guess, started to focus on the need to treat this as a disease rather than a criminal issue. So what that, over the past 5 years, there has been a drastic change in the conversation, and I think that's brought us to a point where we are able to successfully implement something like this in the city.
Still, I'm hearing from people in the community who look at this issue and they're frustrated. They look at their own lives, they say, if I can't pay my bills, if I make poor choices, I'm held accountable for that. Why should taxpayers pay for a syringe access program or a needle exchange when if I do something wrong, I'd be held accountable?
Right. Well, there's so many arguments that show the success of syringe access programs, and one is the economic savings that it provides for the community. So the first thing to be clear is that syringe access is paid through state funding, so it doesn't come out of the local tax dollars.
But still, people pay state taxes, and the Department of Public Health is giving $600,000 to this initiative, right?
Yep. So I guess the most common antidote to say is that a syringe costs about 10 cents, where the lifetime of costing HIV is, I wish I had the exact numbers on me right now, but it's
significantly higher is what you're trying to say?
Around $500,000 or so, give or take. In a case of hepatitis C to treat is about $60,000 to $70,000, and then, and we have this will increase our ability to access a population that's not easily accessible. So we are quite often the first place that people access any form of treatment, and people that access our type of services are up to 5 times more likely to access substance use treatment, and providing syringes to people and also disposal to the community reduces the chances of people becoming infected with HIV and hepatitis C, and reduces the chances of complications that can happen from injection, like injection-related infections. So injection-related infections, different like abscesses or different things that happen are also on the rise, and that ultimately results in people accessing the emergency department. A lot of people that we work with won't access care until they absolutely have to, and I think a lot of that is based around the stigma that people face when they're using drugs. So providing a syringe access program has just been shown over and over to be an incredibly effective prevention tool.
A couple of stats I want to mention from the Centers for Disease Control about hepatitis C and HIV. According to a report, they looked at figures from 2011 to 2015 and found that Hep C cases rose over 1,100%. Is that accurate?
Yeah, I believe that number. A lot of people that we see are hepatitis C positive, and hepatitis C is mainly passed through blood-to-blood transmission.
So people who are using opioids might be sharing a needle, and then that's how the disease is being transmitted. Do we know that, or is that what we suspect?
We know that. That a lot. I mean, obviously not all hepatitis C is contracted through sharing contaminated equipment, but hepatitis C is incredibly contagious. It lives on surfaces for long periods of time. It stays. So the thing with syringe access being available to people is it's the connection that's most important, but around disease prevention, it provides a sterile environment, and it also provides a lot of education around how not to transmit hepatitis C. And that, again, ultimately will save our healthcare system quite a lot of money over time.
So Tapestry now has the go-ahead to establish a Syringe Access or Needle Exchange program here in Springfield, but you also run programs in Greenfield, Holyoke, Northampton, North Adams. Yep. Are there things that you've learned best practices-wise in running these for several years now that you can apply here in Springfield?
Well, I think that the more sites we open, the clearer it continues to become that we always need to listen to people that are actively using drugs. I think that, people that are in the throes of drug use are not taken seriously, and there are so many stereotypes and things around really related to prejudice and discrimination for how people are treated.
It's maybe one thing you hear from them.
Yeah, well, and I'm talking from a systems perspective, so I just want to make it clear, I'm not talking about like us as individuals, because I know that addiction is very difficult and a complex issue. But from a healthcare perspective, people are not being treated correctly when they go into a healthcare setting. It's incredibly hard to access treatment, and a lot of times people are not being listened to and their needs aren't being met. But they're completely disregarded and brushed off because they are completely judged on what they're doing in their life. So we find that connecting with people that are actively using drugs and doing initiatives that are centered around empowering that individual to take part in the health decisions that are made for them, and looking at, just working with them to really be able to have that voice be part of how we can make significant systematic changes. That's what we always need to do. And yeah.
Just very briefly, are you on target now for the December opening that you've been talking about publicly?
Yes, we are.